One of the most unsettling symptoms of chronic lung disease is air hunger, more commonly known as shortness of breath. Unfortunately, breathlessness is something that often comes with battling a lung condition. Those with COPD or other obstructive disorders have a hard time expelling carbon dioxide out of their lungs due to loss of elasticity. The excess CO2 retained in the lungs can cause a number of physical complications, including feeling out of breath. However, sometimes the cause of breathlessness is not just physical, but emotional as well. To feel like you're running out of air is scary and naturally causes feelings of fear and anxiety. These fearful emotions send signals to the brain that trigger your natural fight or flight instincts. This causes your heartbeat to increase, your chest may feel tight, and breathing becomes more rapid. As your breathing speeds up, it also becomes more shallow, making it even harder to retain oxygen and expel CO2. This condition can quickly devolve into a vicious cycle where the patient feels breathless, making them feel more anxious, causing more breathlessness, and on and on. But by recognizing these emotional triggers, you can learn to improve your breathlessness by learning breathing techniques to slow your breath, inhale more deeply into your lungs, and also exhale fully to expel as much CO2 as possible. In the video description, click the link for the active cycle breathing video to learn more about pursed lip breathing and diaphragmatic breathing. These techniques should improve breathlessness, and learning to determine whether an escalation of symptoms is due to an emotional factor versus a physical trigger can also help you to recognize when you're having a physical exacerbation so that you can take appropriate action such as using your rescue inhaler or seeking medical attention if necessary. To keep your emotions from running away with you and making your breathing worse, it might help to do a grounding exercise while continuing to breathe slowly and deliberately. Grounding is a practice that will pull your mind away from panic and distressing emotions. This will corral any spiraling thoughts, keeping your mind from triggering any fight or flight breathing issues, and hopefully bring your breathing back to normal. So we're going to go through a grounding exercise to calm anxiety and bring your breathing back under control. You can stop and do this exercise anytime, anywhere you feel anxious. The first thing you should do is do some pursed lip breathing. Relax, straighten your back, make sure your shoulders stay relaxed, and do some deep breathing. Okay. Breathing deeply through your nose and out through your mouth. If you're feeling breathless, use pursed lips. If not, just exhale fully, but without forcing. As you're mindful of your breath, look around and find 5 things that you can see. Anything at all. Your table, a plant, a tree, a bird, anything. Name your 5 things. You can either do it out loud or in your mind. Okay. Keep breathing. Breathe deep and exhale. Now find 4 things that you can feel. The grass under your feet, the wind on your face, the coolness of the table under your hands, the shirt against your skin, anything at all. Find your 4 things. Keep breathing. Okay. Now find 3 colors in your surroundings. Take a second to notice their vibrancy, tone, texture. Now find 2 different shapes. Notice the sharpness of their angles or the roundness of their curves. Find 2 shapes. Now find 1 thing that you can hear. The hum of the fan, the wind rustling outside, a car in the distance, anything at all. Nice, slow breathing in and out while you listen to that sound. Relax and keep breathing until you feel calm and relaxed. If you still feel a little breathless, do a couple rounds of pursed lip breathing. Keep going. The better you can control your emotions, the better you'll be able to control your breathing. If you begin to feel breathless, check your anxiety and employ the techniques that you've learned to get both your breathing and anxiety back under control.